The Wellness Revolution starts now.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health Wellness Center. And we have got such a great guest today. Love our guest testimonials and success stories. This lady, Karen Syrett, and she's going to talk about her own health battles and how she came out on the other side. Dr. Hotze.
Thanks so much, Stacey, and thank each one of you for joining us here on Dr. Hotze's Wellness Revolution. You know, I've said this over and over again. I believe that you need to have a professional and a staff of professionals who can coach you on a path of health and wellness naturally. So as you mature, you've got energy, vitality, and you're enthusiastic about life. Does that make sense? Without pharmaceutical drugs. This is what we have been in the business of doing back since 1989. And we have a wonderful guest on the program today, Karen Syrett, who lives in Sealy, Texas. Karen came in first to see us back in December of 2020. So it's not quite been a year yet, almost, but not quite a year. And has really had a remarkable improvement. It's really remarkable how well she's done. And the credit, of course, goes to Karen because she decided a little over a year ago she was going to take charge of her health, and she tried a bunch of other conventional doctors and finally came in and she took charge of her health, and we made some recommendations, and she followed them. You know, you can go and see anybody you want when you're trying to get training, whether it's for sports training, piano training, speech training, whether it's physical training, whether it's health training. You can go to anybody, but if you don't follow the directions, you're just probably not going to do well. But this is what separates our practice, is that when Karen came in, we congratulated her and we made recommendations and told her, you're in the Health Olympics. Here's some recommendations. You're the athlete. We want you to win a gold medal. And she nodded her head, yes, I do. I said, but you know who has to do the heavy lifting? And she said, I do, and I will. And she did. So, Karen, thank you for joining us today. Tell us about yourself. Tell us where you grew up. You grew up here in Texas anywhere?
Yes, I grew up in the Woodlands and later moved out to the city here in Sealy about 30 years ago, and I've lived a little bit in Dallas.
Good. So you live out in Sealy now, and you're married. You have any children?
I am married, and I have one son.
Got a son, yes. And he's how old now?
He is 15. He is my first child, and I had him when I turned 42.
Wow.
Yeah.
And I had a little bit of infertility problems, and I finally got pregnant.
Well, I bet you spent some time on your knees asking God to give you a baby, and he finally did.
Yes, sir, he did. He is my miracle child. I tried for 17 years to have him, and I've gone to conventional doctors and specialists and never could figure out why. Finally, I found a health clinic a fertility clinic, and they did all kinds of tests and couldn't find out why I wasn't getting pregnant. And when we were going to do in vitro fertilization, God stepped in and I was miraculously pregnant. So he is my miracle child.
That is wonderful. And just as an aside to you listeners, this is not at all uncommon to hear of women with infertility. And fortunately, thanks be to God that Karen was able to conceive without having to go through, she tried everything else with all these other doctors. Very commonly, a common cause of infertility in women is low thyroid, which often goes undiagnosed by conventional doctors because they look specifically at blood levels and they don't look at the clinical symptoms of low thyroid. It really doesn't matter the level of thyroid in your blood if it falls within the normal range, the range of normal. It has to do with how much thyroid's in your cell, and thyroid governs your body's metabolism. And if your metabolism is sluggish, body doesn't work right, and that includes an inability to get pregnant. So anyway, tell us about you. You grew up in the Woodlands, ended up getting married, moving out. Y'all got married. Y'all moved out to Sealy. Tell me, what was your did you have a normal menstrual cycle all these years without any problems, or were you experiencing any health problems over the years that might have led somebody like myself to have thought about low thyroid?
Yes, I had really heavy menstrual cycles. and it was causing me to have anemia, and I was dizzy and nauseous all the time. And I ended up finally going to the doctor, and I had a gallbladder problem. And while doing the gallbladder surgery, I had gone over to another doctor, and he's like, you need to have your uterus removed. So they did a double surgery and took the gallbladder out at the same time, taking my uterus out. My uterus was extra large. It was laying on my bladder. And my menstrual cycle at that time was so bad that I couldn't even go anywhere without extra clothes. And my fatigue and energy was horrible. And so that's where everything started, is I had a hysterectomy.
Now, how old were you when you had your hysterectomy?
I was probably 48.
Okay, so that was 6 years after you had your baby. Now,
Yes.
prior to your having your child at 42, what were your menstrual cycles like?
My cycles were only had a 3-day cycle. They were on time for like 21 days, and they only lasted 3 days.
Okay, and that was pretty much
My whole life.
For your whole life. Now, after you had your baby, that's when your menstrual cycle began to change.
Yes.
Okay, and it became much heavier. Now, this is common in women as they mature. It has to do with hormonal balance, and it has to do with the amount of estrogen and progesterone levels. So you would have had, based upon your clinical symptoms, which you were having heavy breakthrough bleeding, heavy periods. You probably were having fluid retention, weight gain,
Yes.
headaches. Were you having any breast tenderness?
No.
Okay. So these are, as a woman matures, the hormones become imbalanced. And by that, I mean, they don't make enough progesterone to balance the estrogen. Estrogen is a proliferative hormone that causes the inner lining of the womb to proliferate. And then mid-cycle, that starts on day one of your menstrual cycle, not the period, but on day one of the menstrual cycle, you start making estrogen. And then by day 14 or 15, a woman will ovulate, and she'll make progesterone to promote pregnancy, promote a gestation. And it matures the inner lining of the womb. She's still making estrogen. But as a woman matures, oftentimes she will have anovulatory cycles, which means she doesn't ovulate every month. She doesn't give off an egg. And when she doesn't, all she has is estrogen hormones. And they continue to proliferate the inner lining of the womb. They get breakthrough bleeding. There's no balance with the progesterone. And oftentimes it leads to a surgical correction called a hysterectomy, where the doctor goes, well, I got a solution for that. We'll just take out your womb. You'll stop the bleeding. Of course it does, but it doesn't correct the underlying problem when you had the hormone imbalance. Very commonly, ladies, let me tell you right now, most hysterectomies in America are unnecessary. If the doctor would start a woman on natural progesterone day 15 through 28, they would balance out their hormones, and they wouldn't need a hysterectomy because they wouldn't have breakthrough bleeding and fibroid development. But most doctors don't think that way. They don't think about treating the problem. They treat the underlying, once the problem, the underlying cause of the problem, they wait for the problem to say, well, we'll just cut out your womb, which they did. And they probably took your ovaries out as well, I'm sure.
Yes.
So anyway, that was about 8 years ago. That was 9 years ago. Since you had that when you were 48 and you're 57 now, so that was about 9 years ago. Okay, how did you do after that? How did you feel?
After that, I had felt that I didn't even have my energy. It never came back, even after the hysterectomy. I had a lot of fatigue still, brain fog, focus problems. I started having depression. I started having problems working with people at work. I had problems working at work. My stress factor was really low. My fatigue got really bad.
Tell me this on a scale of 0 to 10, 10 being brimming with energy, the best you ever felt in your life?
Oh, it was a 1.
It
I
was
couldn't
a
even get
1
off
out
the
of 10.
couch.
10. Okay, so
Yes. It took every ounce of energy I had just to get up and go to work, get off work and go back home. And then the weekend, I did absolutely nothing. I sat on the couch. I couldn't even clean house. I had zero energy. It just got worse and worse and worse.
well, how did this affect were you working at the time?
Yes, I was working.
And how did this affect your ability to perform?
Horrible. I couldn't. My job was terrible. I work in a very high-paced, stressful situation in the first place, and I couldn't remember what I was doing walking down the aisle. I couldn't remember where I was going, and my temper was very short. I got angry really easy, and I couldn't get along with the girl that I was working with, and the stress factor at work and trying to focus and concentrate and get my work done was horrible. And I'm a really, really good worker. And it got to the point that I just could not do my job. And I got emotional. I got depressed. And I had a hard time just mainly functioning. I couldn't even go to the grocery store without having pain and aches and fatigue and nauseous and wanted to go back home. So having the hysterectomy didn't help me. All of it just got worse and worse as the years went by, and I didn't understand why.
And how much weight did you gain?
Oh, I had probably gained 60 pounds.
And how did this affect your relationship with your little boy?
It affected my relationship a lot because we were really, really close. And I stopped doing anything with them. And now my son hardly even talks to me because I lost all those years spending time with him.
Oh, my goodness.
And how about your relationship with your husband?
We work, he works, he does everything around the house. He's a really good man. He does a lot for me. He cooks for me. He cleans for me. He does everything because my job and coming home, I just was so exhausted. He stepped in and covered it all.
He sounds like a keeper.
Then my husband eventually had a problem. He had a medical problem. He lost his eyesight.
Oh, my God.
So then I had the extra stress of him losing his eyesight, and I had to take him to work and pick him up from work and then work myself. And then my son had developed seizures when he started school. So I had the stress of that, and then found out he had high functioning autism. So I had the mainstream doctors I had to deal with for my son, for my husband, and for myself. And then, bills start piling up. So life became to the point that I didn't even want to live anymore. It was just too much to handle for me. It was a lot, just living life. It was a lot to deal with. And he tried his best to keep me going. So it got to the point that I had to do something. I couldn't live like this anymore. I wanted my life back.
I remember meeting you when you first came in back in December of 2020, and you're talking about driving your husband back and forth to work and all that.
Yep.
Well, listen, you were in a mess of a heck, ma'am. A mill of a heck is what they say. Oh boy. So anyway, and when you talk to your doctors, what did they tell you?
I've tried to talk to my doctors and tell them that I have this face rash that I think it's coming from the food, and that I want to do food sensitivity test. And they're like, well, I'll send you to this allergist. And the allergist is like, well, we don't do that. And just don't eat food, do your elimination thing. Go take 2 Allegra in the morning, 2 Allegra at night, and some cream from Walmart. And they sent me on my way. So I got nothing from.
But what about all your other health problems, your fatigue and your weight gain and your inability to focus and joint pains? What did they tell you about that?
My pediatrician, my regular doctor, said he put me on antidepressants, and that made me gain weight. And I told him that I thought I had candida, and he just did like this test, and it came out nothing. He didn't really follow through. I told him that I was keep gaining weight, so he put me on Pentermine. I think that's how you say it.
Right.
Diet pill. That gave me. I kept brucitis in my jaws. I kept grinding my teeth. Now my teeth are ground down because of it. And I had a lot of sinus infections, and he's giving me a lot of antibiotics. I had foot surgery, and I had a lot of antibiotics. And after the hysterectomy and the gallbladder, I was on a lot of antibiotics. Every time I go in and talk to him about the fatigue and all of that, he doesn't have an answer.
So how did you end up here at the Hotze Health and Wellness Center? What brought you in, Karen?
I had talked to my sister and told her about my mental problem and my health problem, and told her that I have absolutely no energy. I can't do anything. I can't even get off the couch. Just going, washing my hair was extremely exhausting. And she said, you need to find a functional medicine doctor. You need to go find a holistic doctor. And we started searching. And I saw that Hotze Health and Wellness Center was right there on Fry Road the whole time. And I'm like, this is what I need. When I read everything on your website, I was like, every symptom that's on there, I have every single one. This is the place I need to go. I had approached the holistic medicine with my son because he has high functioning autism. And I never really realized it was something that I needed for myself. And so I made the phone call, and right away, they knew exactly what I was talking about. And I'm like, this is the place I need to go, because she knew right away, every single thing that I talked about, this was everything that you can cover.
So you came in, and tell me what your impression is as you walked into our center, came into our reception room, met with Becky Diaz up there, met with the physicians and the nurses and the staff. What was your impression?
My first impression was y'all did a really good, thorough check. Y'all, crossed every I and T and everything. And coming into the front desk was friendly and welcoming. It was more comfortable than I thought I would be. And all of the stages through the testing and finding out what was wrong with me and was thorough. All the blood work, everything on the very first visit, it was a very friendly, thorough visit to cover everything that I knew that I needed to have. Any questions that I had, they had answers for, and suggestions that I didn't even think that I needed to cover.
And did you feel listened to?
Exactly. I felt really listened to. I have a problem. My son has a problem with the MTHFR gene.
Right.
She knew right away what I was talking about, and all my other doctors didn't know anything about it. And she was willing to do tests that I wanted to have in addition to the regular tests that y'all do. And it was all covered.
Right. Now you saw your provider was Angela Clark, who's one of our physician's assistants here. She's wonderful. The women love her because she identifies well with them, and she's just a delightful young lady and a wonderful provider. So tell us. So I know we did this based upon your clinical symptoms and the studies we had done. We got you on some natural hormones, female hormones, progesterone and bias, which is a combination estrogen hormone, estriol and estradiol. We put you on some thyroid. We got you on some support of your adrenal gland with some DHEA. We put you on some vitamins and minerals. We got you on a yeast-free eating program where we eliminated the simple carbs and the sugar to keep the yeast from growing. And did we treat you for allergies at the time, or were you put on allergy treatment?
No, I did not do the allergy treatment.
So anyway, how have you done?
I feel like I'm doing really good.
What's your energy level on a scale of 0 to 10? 10 being brimming with energy, 0 no energy. What's your energy level?
My energy level, I believe, is like a 9 to a 10.
Oh, that's awesome.
And it was a 1.
It was a 1.
Tell me about your body weight.
I have lost 55 pounds, and I have lost a size of clothes. My skin is changing. I had dry, brittle nails. I had dry, cracking feet. My fingers from the job that I do were dry and cracking and splitting and bleeding. My fingers are finally healed because my fingers hurt doing the job that I do. And now the skin is healed. My face rash is healed. My memory and my focus and my work, my ability to function at work. And the ability to not get angry anymore has like increased to a 10. Everything is like the best ever.
Now, let me ask you this: has your husband noticed a difference?
Yes. He even said he was so glad that he's not cleaning hair out of the sink.
Oh,
But yeah, he's happy all around. I am definitely the woman he married now. I feel really great, and I'm really proud of the accomplishment that I have done.
mm-hmm.
Can you tell?
Should be proud.
Can the people tell a difference at work? I bet they can.
Everybody tells a difference at work. Most of them don't see me very, very much because I'm in another part of the building. And when I go through, it's like I'm a whole nother person every time they walk through. They've even thought, who's the new person?
Oh, I love that.
And I'm like, oh, it's me.
Well, Karen, this is just a wonderful story, and this can be the way anybody can turn their life around if they decide to take charge of their health. And that's what you made a decision to do. You decided at some point in your life, I'm going to take charge of my health. I'm not going to depend upon anybody else. I'm going to go to somebody who's not going to mask my symptoms with drugs, but it's going to treat my underlying problems. And I congratulate you on that. We told you we wanted you to win a gold medal, and we were going to make some recommendations. I would say right now, sweetheart, you got a gold medal.
A couple of them.
Congratulations. I mean, that is just awesome. I'm so proud of you. I'm so proud of you. And it's been less than a year. And I just wonder how many other people are sitting out there and they're waiting and waiting and waiting and don't know what to do. I hope this wonderful story of Karen and her success story by taking charge of her health, and she made an investment in her health. She made the investment. It's not inexpensive coming here. We don't do insurance. It's a cash-based practice. But the most important investment you can make is in your health, because if you have poor health, you don't have anything. You don't have a life. And I could say this, Karen, it sounds to me like you got your life back. And it sounds to me like your husband got his wife back. Thanks so much for joining us today. God bless you.
And if you would like to find out more information on how to become a guest here at the Wellness Center, talk to us about the symptoms that you've been experiencing. If anything about Karen's story resonated with you, then you can call us at 281-698-8698. That's 281-698-8698. Thank you for joining us today at Dr. Hotze's Wellness Revolution.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.